Hello, I'm Dr. David Trumbore from Ultimate Physical Therapy, and today we're going to be talking about neuropathy. And what I'd like to do in this brief discussion is first talk about what a neuropathy is, secondly, discuss the signs and symptoms of a neuropathy, and finally, discuss some of the treatment options we have if you're suffering from neuropathy. So to start with, if you look at the word neuropathy, it looks like neuropathy. Pathy means disease. A pathologist is someone who studies diseases. And neuro means nerve. So a neuropathy is literally damage or disease to the nerves. There's different types of neuropathies and different ways the nerves can get damaged. You can have damage to the nerve endings from diabetes. That's called a diabetic neuropathy. You can have alcohol abuse, which damages the nerve endings, and then you have an alcoholic-induced neuropathy. Probably the most common one is ones that are side effects from medication, usually chemotherapy, and those are called chemotherapy-induced neuropathies. And then finally, there's a fourth type called idiopathic neuropathies. That just simply means we don't know what the cause is, and usually we see these in older people. To understand a neuropathy, I first want to discuss the function of a normal nerve, and that will help us to understand the signs and symptoms when you have things going haywire with a neuropathy. There's two types of nerve fibers. There's sensory fibers, which relay information from the tissues up to the brain about pain and temperature and pressure and position. And then there's fibers that are called motor fibers. Motor fibers run from the brain down into the muscles, and they cause you to contract and to move. So when I raise my arm up like this, the motor fibers have sent impulses into my shoulder, into my arm, and cause my arm to raise up. Now with the neuropathy, you can have damage or disease to the sensory fibers or the motor fibers, or typically both. If you have damage to the sensory fibers, which is almost always the case, that's when you get all the abnormal and distressing sensations. You can have burning, tingling, pins and needles, numbness, stabbing, temperature changes. Often patients will say it feels like someone is sticking them with tacks or needles. Some people will say it feels like bugs or ants are crawling on their skin. Most people will describe neuropathies in their feet, where they most commonly are, as their feet feel like wooden blocks or lead or dead. If the damage is to the motor components, to the muscle, then you're going to have problems with your range of motion, with your strength, with your balance, and with your gait cycle, your ambulation, your walking. Most of the time you have problems with both. And you can have some of those symptoms, one of those symptoms, you can have all those symptoms, depends. Everybody's neuropathy is a little bit different. So if you're watching this video, most likely you have a neuropathy and you're suffering from it, or you know someone who has a neuropathy and you're looking for hope. There's very little typically that is offered for neuropathy treatment, but we have a program at Ultimate Physical Therapy that addresses both the sensory and the motor components of this neuropathy. So if you come in with these kind of symptoms, the first thing we'll do is a very thorough evaluation and examination to see what kind of sensory deficits you have and to see what kind of motor deficits you have. To address the sensation and the abnormal pain and jabbing and stabbing sensations and pins and needles and numbness, we do a treatment called the Rebuilder. The Rebuilder is a specific electrical stimulation machine that we use as physical therapists to treat neuropathies. And the treatment is basically you put your feet in 2 buckets of water, we put electrodes in the water, we stimulate it, and no, you're not getting electrocuted. That's the first thing everybody is concerned about. You'll feel a mild tingling or mild vibration, and what that does is it helps to reduce the abnormal sensations from the sensory damage and help the nerve to repair or regenerate itself. To address the motor deficits, based on our examination, we'll see where you're weak, if you have balance disorders, if your walking is off, and then we'll prescribe specific exercises to improve your strength and your range of motion and your walking, which is very important because if you can reduce your risk of falling, that will go a long way to keeping you safe. So we know that if you have neuropathies, that there's a huge quality of life deficit, that it impairs your quality of life. We have an effective treatment that we can offer you. So I want to encourage you to contact our office, set up a time for consultation, and we'll be glad to help you in treating your neuropathy. Best wishes.